I'm a diagnostic radiologist, did my training medical school at Ohio State University, and then my internship, residency, and fellowship training at Stanford University. I have an outpatient imaging center business called Desert Medical Imaging that's located in the Palm Springs area of Southern California. In terms of how regenerative medicine has changed my perception of medicine, it's clearly a new horizon, kind of, where things are going next, part of our medical practice. It's an important part of our clinical research right now. We found in our patients, previously most of which we see for pain management, for problems like back pain, knee pain, hip pain, that's mostly related to either arthritis or degenerative disc disease in the spine, that the SVF therapy has really helped to improve their pain by helping to reduce the inflammatory response of the body. So there's kind of three main effects, that two of which we've observed directly, which is the reduced inflammatory response by the body that results in really high quality pain management. Secondly, there's an immune modulation effect that we've observed. And these are patients, for example, that have inflammatory arthritis like rheumatoid arthritis or psoriatic arthritis. And if we treat one of those joints, not only does that joint tend to improve in terms of pain and swelling and decreased function, but other joints that we didn't directly inject tend to get better also. So we think that's evidence of an immune modulating effect. The third effect is the one that's most clearly still in the research component of things, and that's how much of the SVF therapy actually results of rebuilding of tissues that have been previously damaged. And this takes, several years to kind of establish which tissues rebuild and which don't. But our preliminary experience has been very, very good. As radiologists, our contribution to SVF program is three components. First of all, we help the clinicians to determine the target sites for injection. For example, someone who comes in with back pain, there are all sorts of things that can be a pain generator in your back. It could be a herniated disc. It could be wear and tear arthritis in the facet joint. It could be a little annular fissure, which is a little tear of the annulus fibrosus that surrounds the disc that results in an inflammatory response. But we do MRI with and without contrast, and the contrast enhancement helps us to look for the inflammatory response that tends to correlate the best with what the cause of the patient's pain is. So the first component is determining the target site by contrast-enhanced MRI. The second component that we contribute as radiologists is image-guided deployment. So there are some applications for SVF that you can just treat intravenously, and you don't really need to place a needle directly where the problem is. But then there are others, like a herniated disc in the spine, or if there's wear and tear arthritis in the hip, osteoarthritis, where imaging, especially CAT scanners, are used to help us deploy the stem cells in precisely the location that we want to deliver them, literally within a few millimeters. Then the third component of our program that as radiologists we contribute is follow-up imaging to help to document in an objective way whether or not things have gotten better. So clinically, we'll use PROMs, these patient response outcome measures, which are questionnaires to hear directly subjectively from the patient if they feel better or not. But in addition, we get objective evidence that they're getting better using follow-up imaging to see if the problem that they originally came in with, in fact, is getting better over time. So as radiologists, our role is a bit different than the other clinicians who are mostly diagnosing and treating the patient. We provide this additional service of determining the target, deploying the SVF very precisely to the target, and then doing follow-up imaging to document whether or not things are healing and getting better.